sunshine. It's our sunshine.
Hello my countrymen, nice to be back with you. I am Dr. Vikram Sharma, neurologist at Sunshine Hospital, Gachipoli. Today I just wanted to give a message that this month is going to be the World Stroke Month. October 29th is celebrated as the World Stroke Day. So I was just going to give you awareness about stroke and what's happening in the latest background. So this year has been marked as that because COVID pandemic has happened, many people have stayed back at home and missed the treatment of stroke. So the World Stroke message of this year stands at that please don't be at home. If you have a stroke, go to the hospital. Don't stay at home, because if you are going to stay back at home, to treat the patient who has got stroke becomes really difficult in the future. I would also make you aware that COVID has caused a lot of neurological signs and symptoms which can present as stroke feature, which are really not the stroke feature. So you would like to ask me what happens when a patient has got COVID and what other neurological signs can be presented when a patient has got COVID. The first sign what you can have is an issue with your nose. You may feel that you are not able to smell things around you. That happens because the COVID virus affects the nerve of the nose. That is why you may not be able to smell some things. You may also find it difficult to have a taste. So this can also be because of the COVID virus. So please don't worry about it. As and when the COVID virus is treated, this smell and the taste sensation comes back to you. So please don't be worried about that. Symptoms can also affect you by having headaches. So when you have a headache, it is also a sign of COVID. So I would request you to get to the nearest hospital, get yourself checked for COVID-19, and if your test is positive, meet a neurologist. So make you aware of the stroke once again. A stroke is a disease in which your hand or leg could be affected. It may not work properly. You may have a loss of speech. You may not be able to talk properly. So identify these signs of stroke. The best way to remember is FAST. The words FAST, F-A-S-T. So in which you can see F stands for facial deviation. That's you may see an abnormal face. Arms, you can ask somebody to extend their arms outside. If there's a dip in the arm balance, this is another sign of stroke. S stands for speech. T stands for time. So do not waste time, get to the nearest hospital. There can be two kinds of strokes. The one in which you can find there is a clot in the brain, because of which the blood supply to the front portion of the brain gets cut off from the clot region. That can cause a paralytic attack. There could also be a stroke which can be because of the bleeding in the brain, in which also you can have the signs and symptoms of the stroke. So this gets identified when you reach the hospital. You can also have symptoms of stroke when you meet with a road traffic accident, in which you may have a bleeding in the brain, which can also present as stroke. A person may become unconscious, he may not be responding. I would request you to take such persons to the nearest hospital possible. Thank you once again. Nice to be with you. I'll come back with some more talks about neurological diseases.